Welcome to Parker University. This is Bill Morgan, president of Parker University. And with me today, I have Brian Budgell, who's a PhD, DC, who's our visiting scholar today. We're just going to talk about the linguistics of chiropractic. Brian, could you tell us a little bit about yourself?
Thank you, Bill. Well, as you understand, I'm a DC and also have an interest in the neurosciences, but spent a number of years in Japan, 14 years in the most recent visit, and encountered a great many colleagues in Japan who were struggling to publish their research in English and fell into helping them. And this led me into inquiring about the nature of the language, how to improve people's ability with the language, and therefore how to study language. So I became sort of an amateur linguist, if you like.
Well, in chiropractic, language is very important to us. We argue about the definitions of words, whether we should use words. Some of them have historic value. Some of them are people are passionate about not losing our identity as chiropractors. So how did you become specifically interested in this? Basically, what your time in Japan is what brought you to where you're at today, this to understand the variances in language?
Well, certainly that's what introduced me to the challenges and the techniques of linguistics. But what made me interested in chiropractic language was coming back to North America after having been away for 14 years. When I left, particularly in Canada, we were a sensible and very calm profession. And when I returned, I turned my back for 14 years, and what happens? It seemed to be much more of a divided profession, and often divided over what seemed to be relatively trivial linguistics issues. And so I began to take an interest in the lexicon of chiropractic, subluxation, adjustment, so on and so forth.
So you've published extensively on this topic. In addition to being a science researcher, you've published extensively on language and linguistics and lexicon. How many publications have you produced?
I think about 8 or 10 peer-reviewed papers in linguistics. We have a few more under review right now. As I've explained to you, I've written a couple of books on language acquisition. So it became quite a serious hobby or line of research for me, a secondary line of research.
So do you think chiropractors understand our own language barriers and what's going on in the profession?
Oh, no. And we're not unique in that regard. It's like a fish trying to understand water. You know, we're exposed to it so much that we become insensitive to it.
And I've worked in various organizations. You know, here I'm at a chiropractic college where the lexicon is common language. But I've worked in hospitals where I've had 2,000 providers where they don't understand my language.
Yes.
And, you know, they understand the adjustment. They understand the word chiropractic, most of the things we say. But if I say this person's got a cervical subluxation, half the hospital is going to want to put a hard collar on that person's neck.
Mm-hmm.
So it really is what determines what language we use.
Okay. Well, what is the purpose of language? And the purpose of language is to communicate. So if we put together a spoken or written piece of text which effectively communicates, that was successful language. So language belongs to the people who are communicating or trying to communicate with one another.
Makes sense. Now, on social media, we talked a little bit about this yesterday. We have arguments and divisiveness between different factions. And on both sides, it seems that there's self-righteousness and indignation and almost arrogance.
What a surprise, eh?
Yeah, maybe a little dogma in there, too, on both sides of the argument on what should be done. I know when I travel abroad, a lot of the countries abroad are basically rejecting the word subluxation. They want that taken out of the lexicon. What do you think about that?
Well, if you're going to take it out, you're going to need to put something else in. The linguist point of view is that the actual word doesn't matter. Sounds coming out of our mouths are of no particular consequence at all. It's the meaning behind the words which are so important. So if people choose to use the word subluxation and they have a shared meaning for that, and it helps them to communicate with one another, then that's a perfectly fine thing to do. And for an outside entity or some authority to try to come in and get people to change that is, it's not doing anyone a service. We want to improve communication, not interrupt it.
So if I hear that right, is if I come to you and we're changing the words we're using, if you reject that, I have no effect upon you.
Well, historically, this is normally what happens when authorities try to change language, they fail. And all you do is disrupt communications until finally the authority is overwhelmed.
We look at countries that like Ireland or Wales, where the native language, the Gaelic, has been replaced by English. So is that an example of what you're talking about?
Well, and a good example, or good examples, where people have tried to eliminate languages and failed. People, if they wish to communicate, will find the way to communicate that works for them. And authority has essentially no influence in the long term.
Oh, interesting. How about with medical collaboration? You have two different professions using different lexicon. We come together. Like for myself, I've worked in a hospital with 2,000 other providers.
Mm-hmm.
Hard to get 2,000 people to start speaking my language.
Indeed, and probably what you do and what I do is I adjust my lexicon according to the people who I want to communicate with. So when I'm talking with chiropractors, particularly older practitioners, I gravitate towards subluxation, and I know that we can establish a shared meaning. If I was talking with another group, I might use the word restriction or fixation. It's of no particular importance to me. My goal is to communicate effectively with people. And if I can give you an example from another profession, where using one word in different ways does not create problems, perhaps that will illustrate something useful. I think that one of my sons is a nurse.
Mm-hmm.
And when we use the word nurse, most often people think of a person, a member of a profession. But nurse has another meaning, doesn't it? As a verb to breastfeed a child. Mm-hmm. It's the same word with two different meanings, but people never confuse the meanings because context saves the day.
Truly.
And so the same ought to be true with subluxation or restriction or what have you. Within the context of our conversation, people are going to work out what the meaning is, and they'll survive quite nicely.
Is the term chiropractic subluxation scientifically defendable today?
Absolutely.
Has it changed in meaning since D.D.? Oh, you would say D.D. didn't even coin it.
That's right. Well, we know he didn't coin it. The word subluxation was around long before D.D., and it had essentially the meaning which he adopted, which was bone out of place, impinging on nerve, interfering with function of downstream organ.
And that was that abnormal, or was that a scientific breakthrough when he brought that, or is that accepted knowledge back when D.D. Palmer first presented that theory?
Well, I'm not quite old enough to remember. However, he was adopting the lexicon which was current in his time.
So basically, he was using the standard language of the day, scientific language. Has it changed meaning in the last 100 and some odd years?
Well, that's a good question. Of course, all language evolves over time. And it is possible to actually analyze the language of many years ago and the language of now, something which linguists regularly do, and to see how words have evolved. We have looked at the lexicon of, for example, my school, CMCC, when it opened back in 1945, 1946, so from about 70 years ago, and seen what subluxation meant then, and what it meant then was in fact a bone out of place, impinging on a nerve, and adjustment fixed it, by the way. We can see that by analyzing the language. Can I talk a little bit about the methodology?
Please.
Yes. So the way in which linguists approach this sort of thing is that they develop corpora, which are large collections of a language, which they think are representative of the entire target language, and then use automated means to analyze that language. So, for example, we collected several 100,000 words from the old curriculum, fed that into a computer, and used a computer program to pull out all of the examples of subluxation, and then tried to parse those various sentences or phrases into a natural taxonomy, if you like. And we saw that at that time, many years ago, there was this one unified meaning. We've repeated the exercise fairly recently using the modern CMCC curriculum, and it's clear that there are three core meanings for subluxation these days at CMCC. And those core meanings are, number one, the subluxation lesion, if you like, the acute event where something suddenly goes out of place. And other people have referred to this as spinal buckling. And it's a good defensible model. It makes sense in terms of biomechanics. It has coincidentally been accidentally caught on video fluoroscopy. It's also been duplicated in the laboratory. So there's no question that this entity exists, and subluxation is as good a word for it as any. But if you wanted to call it spinal buckling, and if that conveyed the meaning properly, then that would also be a good term to use. The second meaning that we see at CMCC is what we might think of as the clinical constellation of subluxation. And this is something which is widely agreed upon. It is an acquired paraspinal biomechanical lesion, which manifests as something that all of your students know. It is the pain on challenge or palpation. It's the asymmetry of position or motion, the restricted range of motion, and the tissue texture changes. The parts or the tarts constellation, if you like.
Which is essentially what D.D. Palmer described in his writings.
Sadly, exactly.
Have we gone very far in figuring this from the...
We didn't have anywhere to go because he was right to begin with. And the research validates the methods that we use to discover the pain or the tenderness on palpation, the asymmetry of position or motion. So this is something which is widely adopted by consensus. It is as good a clinical definition as the clinical definition of rheumatoid arthritis or cancer or anything else. So that's very fine terminology. But if you wanted to call it something else and say, that's a chiropractic restriction, well, God bless you, that's perfectly fine, as long as the person with whom you are discussing understands that that's the definition.
And I'm sorry, you're going to go on.
Well, I was going to tell you about the third meaning for subluxation at CMCC, and that was whatever's going on in the underlying tissues. And that's an area where we don't have consensus, nor should we, because as you understand very well from your clinical practice, people get subluxations in many different ways. And so your whiplash injury might result in a facet joint being irritated. Mine might result in a small paraspinal muscle being strained. So the actual tissue, which is the target of the overloading, would be different. The pathologies are different. So we shouldn't be looking for one biological model. We should allow that there's a diversity in the same way that there's a diversity of diseases we call arthritis or diseases which we call cancer.
Most of our arguments probably happen with your third definition, where the evidence-based crowd, of which I think you're the epitome of an evidence-based...
Oh, God, time to end it all then.
Oh, you're not an evidence-based chiropractor? How would you describe yourself?
A scientist.
A scientist.
I'm still looking for the truth.
Okay, very good. Well, there's so much argument going on, and we try to discuss what really is that. And at times, we're probably arguing about that third definition.
I believe so. Yes.
That's where people who are like, well, it's a strain, it's a facet syndrome, it's a fixation. That's a subcategory of the third definition of subluxation.
Yeah.
So, do you think we need to reject that term?
No, it's a perfectly fine term. You could call it anything you wanted, as long as the people who are trying to communicate with one another understand a shared meaning. So I have no commitment to the term subluxation. If you want to call it something else, that's perfectly fine. But what we should be trying to do is worrying less about the sounds that are coming out of our mouths and more about investigating what that thing is. Because when we understand that, we're going to diagnose more effectively and we're going to treat more effectively.
Truly. So I've heard Scott Haldeman say that subluxation is conceptual. What does that mean to you?
I have no idea what Scott had in mind when he said that. But as I've said to you, to me, subluxation is a real disease. It's not a hypothesis. My patients would come in with something that really made them sick. And I would use chiropractic techniques to locate that problem and to fix it. So it was absolutely a real disease. But certainly I want to understand more about it. But there's nothing hypothetical or conceptual about it to me.
Very good. This is real valuable, this conversation. I'm going to bring up a few other terms. What does innate mean?
Different things to different people. However, when D.D. Palmer began to use that term, he, again, was using the lexicon of his time. And you would understand that he was alive at a time when people did not understand that the central nervous system was a multicellular organ. The leading neuroscientists of the time thought of it as essentially an acellular jelly. Synapses had not been discovered. neurotransmitters hadn't been discovered. There was no such thing as the autonomic nervous system. So he used the language of his time to express what he had observed. Were he alive today, he probably would have called it descending inhibition or something else.
Very good. So when you see people use innate with an capital I, what does that tell you?
But I'm not offended by the words people use at all. I'm only concerned that they are able to accurately convey their meaning.
Very good. How about the word chiropractic?
What a wonderful word.
It is. It is a great word.
It is. And as you understand, the word chiropractic and chiropractor also predate D.D. Palmer. Chiropractor was a term used for these itinerant bone setters in Great Britain long before D.D. came along, and I suspect whoever suggested the term to him had heard it previously.
And I've worked as a chiropractor in a physical medicine department in hospitals under the Department of Manual Medicine, which literally means chiropractic, means manual medicine or manual practice. How about vitalism?
An interesting term, and I often don't know what people mean when they are using that expression. As I may have explained to you previously, from a biologist's point of view, vitalism was the theory that life was independent of the vessel which contained it, which therefore allowed that you could transfer life from one vessel to another to impart life in something which was inanimate. And whenever that theory has been tested, it has failed. And you can't take a failed scientific theory and recycle it as good philosophy, because science and philosophy are the same thing, aren't they? They both involve the love of knowledge. But I suspect that when people these days use vitalism, rather they're talking about the spiritual aspect of care, and hopefully all of us contain some degree of spirituality and convey that in our care to our patients.
That is for me. I often in my lectures will ask if you believe in God, and if you're someplace where people believe in God, I believe in God. Well, I believe that extra divine spark. To me, that is vitalistic. You have the belief in God that there's something bigger than you, that we're not contained simply in our vessels, but we are part of something bigger, and we're spiritual beings. Mm-hmm. And I know a lot of people don't believe in that as well. But anything else you'd like to share about linguistics and chiropractic? It's just been fascinating talking to you.
Well, just don't get bent out of shape about the words, because these are transient things. They're just sounds coming out of our mouth. Let's try to communicate better. Understand that language evolves. If people come up with better terminology, let's examine it objectively, and if it works for us, let's take it on.
Brian, thank you so much for being with us today, and thank you for joining us at Parker University.
My pleasure. Thank you very much.